Hi, this is Andrea Kane, and I am here with you again. We are on week 13 for HSC 114 Medical Terminology. If you are looking at your syllabus, you'll notice that the first video for this week was Chapter 19 on Cancer Medicine Oncology. The second one is going to be on Radiology and Nuclear Medicine. Before I get into that and go into Radiology and Nuclear Medicine, I want to give you a heads up. This is the last week before Thanksgiving. Next week is Thanksgiving. So this week you have weekly assignments and weekly quizzes on chapters 19 and 20, as always, and you have your online discussion. And then next week you just have a discussion online and you have an assignment on medical terminology, and that is an assessment of your critical thinking. So next week there won't be any lecture videos, there will not be any quizzes, there's just one discussion and one assignment. We'll be back again together week 15, which is the week after Thanksgiving. You will have lecture videos on chapters 21 and 22. However, your weekly assignment and weekly quiz will only be on chapter 22. I'm going to go over chapter 21 because it's good information for you to have, but I'm not going to test you on it because most individuals who take medical terminology end up having a pharmacology specific course for whatever allied health field they're going into. So I'm not going to get too deep into pharmacology. I'm going to do a quick skim, but just wanted to bring that to your attention. And then we're up to week 16, which is our last week. So wanted to cover that in case if I waited till the end, perhaps it would be missed. All right, so let's talk about radiology and nuclear medicine. What do we need to know? Well, we're going to talk about the physical properties of X-rays, go through diagnostic techniques used by radiologists and nuclear medicine physicians. We will talk about the views and patient positions. It'll kind of remind us back of chapter 2 when we talked about those positions. Look at radioactivity in diagnosing, and I would argue here, I'm arguing today with the slides because I disagree. Diagnosis, and I wish they would have inserted and treatment of disease, because nuclear medicine is often used to treat disease, not just diagnose it. So I'm going to argue a bit with the book on this. Recognizing medical terms that are used in those specialties, and then make sure we apply our medical terms in proper context. So let's take a look. I am on page 794 in your book. Radiology is the medical specialty that looks at producing, that produces and interprets images of the human body for diagnosis and then subsequent, sometimes, treatment of disease. Because radiology, yes, it is diagnosis, but there's a piece and a part of that, like interventional radiology, that's actually utilized to treat disease sometimes. So I'm going to argue again with that a little bit. But anyway, radiology is all about producing and interpreting images of the human body. X-rays are invisible waves of energy. Nuclear medicine uses radioactive substances. So anytime you see nuclear medicine, you're thinking radioactive substances. And again, it should be diagnosis and treatment of disease and treatment. All right, so what's a radiologist? Well, they are a MD who has, and can be a DO, but who's decided to specialize in the field of radiology. And they can be a radiologist without doing interventional radiology. Some, you have to go on and get special training and certification to become an interventional radiologist. So we'll just talk about plain old radiologists that interpret those images. And then there's nuclear medicine physicians, and some of those actually not just work in the field of oncology, but then they go on and may become nuclear physicist as well and calibrate the equipment. So you get some really interesting crossovers between just the plain topic of radiologist and the plain topic of nuclear medicine physician. Then of course there's techs that work in the field of radiology, nuclear med, and ultrasound. So what are the characteristics of X-rays? They expose photographic plates, typically. That's the traditional way. We're now into the digital world where that's not always needed. They penetrate substances, X-rays do. They are invisible. They travel in straight lines. Do you ever notice that when you get an x-ray, they always make sure your foot or your arm or your chest or whatever is placed in a very particular position, and you have to stay right there. And if you ever notice that the machine, it is designed for the x-ray to go straight down or straight through. It doesn't, it's a straight line. Even if it goes diagonally, it's a straight line. There is some scatter and some ionization. And if you want to look at what all of these mean, they're on pages 794 to 795. There's digital radiography now. There's CT or computed tomography. There are contrast studies. I'm thinking of the barium swallows where they're looking, where you swallow a liquid that has contrast in it, and it goes down and it shows what's happening. Your throat, goes down through your esophagus into your stomach and on. And then there's also use of iodine compounds. And your book covers all of these really well. So I'm going to defer to your book. And yeah, because that's really a great place to look at it. There's also fluoroscopy, often used in conjunction as someone's doing a procedure. Digital imaging techniques, interventional radiology, which I've talked about. If you're curious at all about interventional radiology, look it up online. It's a fascinating portion of radiology, and it has just exploded over the last 10, 15, 20 years. Interventional radiologists now do things that used to only be done by surgeons or other specialists. And I have known some interventional radiologists, and they are really super cool people, very knowledgeable, very detail oriented. Then there's ultrasound and MRI, magnetic imaging or magnetic resonance imaging. Positioning. Oh, remember our posterior and anterior and lateral and all of those? Well, here we go. Postero-anterior means that you're going from back to front. So think from and to whenever you see this. Anterior-posterior is the opposite. You're going from front to back. Lateral view, you're going from one side to the other. And typically, if you're in the left lateral view, then you're going from right to left, if that makes sense. Oblique view is that slant, that perpendicular plane, that diagonal type thing. And then the position of the patient, you've had all of these before. So brush up on those and make sure that you are comfortable with them. And you've had these positions before, I believe, as well. So again, brush up on those. An example, if you are laying down and very comfy in your recliner, you are in a recumbent position. And typically you are supine. You're in a supine recumbent position. Obstructing the passage of x-rays. Quick quiz. We all know that radio is x-ray, and that's there as the root, but which one of these suffixes means obstructing? And I think you can get it. If not, check your book. All right, nuclear medicine. We are now on page, I've skimmed ahead here and didn't keep my book up. Okay, we're up to page 804, bottom of 804. So let's talk about radioactivity and radionuclides. A radionuclide or a radioisotope is a substance that gives off high energy particles or rays as it disintegrates. These are produced either in a nuclear reactor or a charged particle accelerator or by irradiating stable substances, causing disruption and instability. There are three types that you'll typically hear about: alpha particles, beta particles, and gamma rays. Gamma rays are the strongest, the most effective. Not really sure why. They just have greater penetrating ability than alpha and beta particles, but I'm sure if you wanted to get into that, you could get right down to the nitty-gritty details. There are two types of nuclear medicine tests. One is in vitro test tube, and one is in vivo in the body. So if you're thinking in vitro, that means it's come from the body and it's being the nuclear medicine is being applied outside the body. So be thinking blood, urine, that sort of thing. In vivo means the nuclear medicine radioisotope is actually being applied within the body. So think brachytherapy, that type of thing. Oh, sorry, I should have gone on to the next one. So it defines what in vitro is, and the fact that you're using those radioactive chemicals and antibodies to detect hormones and drugs and all sorts of other stuff. And then in vivo, that's where it's given to the patient, it's placed within the patient, and then you can use a scintiscanner, gamma camera, to detect and produce a picture, a scintiscan. Procedures that use radionuclides are bone scans, lymphoscintigraphy, PET scans, that are the positron emission tomography, PET/CT scan, where you're using both types together. Single photon emission computed tomography is SPECT, and you'll hear SPECT. You won't hear that long drawn out. You will not hear this. You'll hear SPECT. And the same thing with cardiolite. You'll never need to know this unless you actually go into nuclear medicine as a field. Otherwise, you'll never hear about it, never see about it. They'll talk about cardiolite scans, and that has to do with the heart, with the field of cardiology. Thallium scans are also cardiology scans, and then thyroid is just what it says. So let's talk about PET scans particularly. And PET scans, let's see, this is listed on page 806. It's number 3 here, and it goes through there. You're using radioisotopes for the emission of positrons. It's through IV injection. You wait to see where they concentrate in tissues where the radionuclide is or is not being metabolized, and it depends on the radionuclide, it depends on the tissue you're targeting. But anyway, it is useful for treating all of these things, but it's also most commonly used to identify metastasis in cancer patients to see if they've got uptake in any other areas. SPECT is that IV injection of a radioactive tracer. This really allows 3D images. So when you think SPECT, think 3D. And again, it's things like liver, a heart, bones, those types of things. Vocabulary: CT, contrast studies, gamma camera, gamma rays, half-life, interventional radiology, in vitro, in vivo, ionization, MRI, nuclear medicine, positron emission tomography or PET scan, radioimmunoassay, radioisotope, radiolabeled compound, radiology, radiolucent, radionuclide, radioopaque, radiopharmaceutical, scan, scintigraphy, or scintigraphy, sorry, gotta spit that one out. And then SPECT, tagging, tracer studies, ultrasonography, ultrasound transducer. That's that handheld device that sends and receives. So if you've ever seen an ultrasound and you notice they've got this handheld device and they're running it over whatever body part they're doing the ultrasound on, that's the transducer. Uptake, ventilation perfusion studies. If you see VQ scan, think lungs. VQ scan is lungs. So ventilation perfusion studies. Which of the following is a handheld device? Oh, we just covered this. Hopefully you get it. All right, combining forms. Remember our equation. You have a root, you add a combining vowel to it, and that equals a combining form. So we have fluoro, iso, pharmaceuto, radio, rentageno. And watch out, because the last two are x-rays, both for x-rays. Sano, therapeuto, vitro or vitro, and vivo. Then we have suffixes. Gram and graphy are very familiar to us, but new this time are lucent and opaque. Prefixes: cine, echo, ultra. And then we're back to abbreviations. And again, these just focus on imaging and positions and the different types of treatments that they do, or diagnosis, testing that they do. You don't need to know things like the 123I for isotope of radioactive iodine or anything like that. Again, unless you go into that field specifically, you probably will never experience it. And some more abbreviations, and more abbreviations, and another quick quiz. Movement away from the midline of the body. Remember, to and from, toward the body, away from the body. and hopefully that will help you. Lying on the back, we talked about this. If you are in the recliner, you are in which position? You should know this. All right, that's it for this one. Hope you have a great week. I hope you have a fabulous week of Thanksgiving, and I'll be back week 15 to talk to you about our last 2 chapters. Take care.